Hey everybody, it's Dr. Kipp coming to you live on a beautiful Tuesday afternoon. Pro Health Chiropractic is my practice, and the topic of this discussion today is why do we X-ray? You know, a lot of patients over the years had said to me, "Oh, well, I really don't want to get an X-ray." Well, the truth of the matter is, to see is to know, and not to see is to guess. And frankly, I'm not going to guess about any practice member's health when they come in to see me for the best level of care possible. So let's take this for example. We'll call him John. John came into my practice, this is probably 10 years or so ago, and he was complaining of some lower back pain. Well, he had been to other doctors, he had been to other chiropractors, and so he landed at my doorstep at the referral of another great patient of mine. And so he comes in and says, "Can you help me?" And my response to that was, "Well, I can see if I can, but in order to see if I can, we need to do some evaluations." And up until that point, interestingly enough, there wasn't anybody who suggested taking x-rays of his lower back. They were, taking him through regular orthopedic testing, which we do, some range of motion testing, which we do, but nobody took an x-ray. Now, unfortunately, this particular story ends with me picking up on a cancerous tumor that this gentleman had. And I referred him out, obviously, because that's outside of my scope of practice. But had I not taken an x-ray, we never would have known it. Now, again, this is the rare example, but the importance of being able to see what you're working on is paramount to the risk of radiation. Let's say that. Because nowadays, folks, the technology that is out there, and we have a digital x-ray system, it emits the lowest possible dose for the exposure, and we only take the areas that we need to see. But then when we see them, we can evaluate them strategically and mathematically and look to see what is actually going on here. Is there something that's out of position? Is there something that is jammed up? Is there something that is the entire structure flawed? And if so, what has that led to? So, for example, we can look and see if there's arthritic changes there, degenerative disc disease there. And so that gives us a clue as to how long has this issue been going on really? Sure, you might only have had the pain for the last 5 weeks or 5 months, but it might have been a process that's been building and building over the last 5 years. And so in terms of finding out that information, it's critical now for me to see that so I can say, look, John, your issue didn't start yesterday and it didn't start when you first experienced your pain. This problem has been going on for quite some time. And guess what? Don't expect it to change back overnight. But if there's help that we can provide as a chiropractor, then we do. And frankly, folks, I don't think there's a spine out there that couldn't be benefited by chiropractic care. It is the tune-up for the spine and for the neurological system in the body that controls everything about you. So do yourself a favor. Get yourself checked by a chiropractor. Make sure that you're getting some x-rays done at some point, whether it's at the chiropractor's office or if you need them done elsewhere, if your chiropractor doesn't have them, by all means, get them so they can be evaluated and make sure you're getting the right care. Folks, thanks so much for tuning in. I'll plan on seeing you for my next tip. Take care.